Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. This is Dr. Craig Stern. Today we're going to be talking about a topic about hospital inflated prices. I'll go more in depth about it, but we're also going to talk about the insurance tax penalty from the ACA. First and foremost, we're going to talk about healthcare is expensive, and this is not news. The government keeps arguing about who's going to pay for the bill rather than why. As in, why is healthcare so expensive? And hopefully, Dr. Stern can help us with that. Dr. Stern, there has been reports about how disproportionate medication and services cost the hospital versus the patient. Why is that, in your opinion?
Yeah, this is an old story,
Mhm.
and I don't mean that in a negative way. What I mean is that it has been well known for a very long time that hospital charges are high in comparison to what the costs are, whether it's for drugs, because years ago there were stories about $6 or $8 tablets of Tylenol
Mhm.
that people could buy for a couple of pennies. There were issues with regard to the cost of surgeries and procedures and all of that. And the common statement at the time was that this covers overall costs. So it's not just the cost that you get per diem when you go to a hospital that deals with the food and the nurse and the bed, but there was all the other things that were being done and you needed to cover that. And drugs were not included in that, so that was a separate charge. And so there were separate charges where costs and premium were up. And there's probably arguments on both sides as to whether that's true. Fundamentally, however, the biggest problem is transparency. The question is, why is it that no one can tell what the true cost of hospital costs are, whether it's for the bed, whether it's for the nurse, whether it's for the drugs, etc. And there is no really simple solution to that. But 15 states, and now there's two more with bills on their dockets for this year, West Virginia and Florida, have taken a different approach. And they've said, look, right now in all states other than in those 15 states, a hospital or a care service facility has to file what's known as a certificate of need. And by the way, I explain more of this in the next pharmacy benefit news that comes up next week, I think.
Yeah, we'll share a link about that.
Good.
Yeah.
And the bottom line here is that certificates of need are out there in order to ensure that there's not too many hospitals, too many care service areas, etc. And the idea was that if you had a smaller group of service areas like hospitals, etc., that in fact they wouldn't have to compete as much and prices would come down. In fact, it hasn't come down. It hasn't come down at all. So what they've done is to say in those 15 states is they've removed certificates of need and they've said, but as a substitute, we want to get data that we can use and patients can use to compare prices of services, compare prices of drugs, etc., so that people can make a choice. And that is a response to the fact that insurance, more patients are paying up a greater share of the cost, whether it's in copays or deductibles.
Right.
So the way that they're trying to handle this is to bring the cost down, not with certificate of need and effectively constricting the number of facilities, but now with whatever facilities come on board, they're going to have to show data, and now they're going to be competing in the market over data. That's probably the biggest thing that's going to happen, because no matter how we argue this, and whatever the arguments are, pro and con, at the end of the day, transparency, like we've talked about before, and transparency of pricing for manufacturers, drug
Pharmacy
manufacturers,
benefit.
pharmacy benefit managers, health plans, and now issues with regard to hospitals and infusion centers and emergency rooms, etc., all of them have to deal with. And by the way, just to be clear, when they remove these certificates of need, they require that if a hospital comes on board, they have to have an emergency room so that people who can't afford doctor care can come to the hospital and can get emergency services. So they're not removing everything, but these 15 states or so, and probably will be another 2 or 3 that'll be 17 or 18 states, are trying this different kind of competition mechanism to do with it. We can argue forever about whether this particular thing is expensive or this bag is expensive or whatever, but nothing's going to change. So this has been probably the biggest thing to go after the issue and to deal with it with facilities competing on transparency.
Right, and I can go on and on with several different questions just from what you had said alone. But for time, I'm just gonna focus on why is nothing being done to regulate what the hospitals can charge?
Um, that's also a good question, and probably there's not a lot of impetus by Congress to get involved in this issue. The doctors have a very strong union that comes in to talk to all of the Congress people. The American Hospital Association deals with it. It's really, I mean, one could argue, but in fact, it's really not good guys versus bad guys. It's people dealing with special interests that happens with almost everything that goes on in the United States. But at the end of the day, there isn't a lot of regulation on the services because there's always been the argument that in some fashion the states or federal government have tried to either restrict access to these places so that people will compete more, or they'll compete over the marketplace. And the idea in general is to let them compete over the marketplace rather than get down in the weeds arguing about whether the doctor's charges are too high or the facility charges are too high or otherwise. What governments have done, what state governments have done, is to come in and say, well, we're going to do a 10% reduction to what we pay doctors, a 10% reduction to what we pay pharmacies, and then reductions to hospital fees. So they've tried to deal with it on a cost basis, giving reductions, rather than trying to get in the weeds. It's a very complicated process, and in general, government and others just haven't gone after all of them. I know that that M here is going to attach a whole list of articles that have come out in the media recently about this, whether it's from Health Affairs, which is a very respected journal, or other areas. It's just a matter where people are trying to use the marketplace, benchmarks, and otherwise to control this cost, rather than trying to get into every possible area and trying to control the cost.
Yeah. But if you just do it on a state level where doctors are getting paid less, they'll just move to wherever they can get more. Right?
They'll move to wherever they can get more, or they'll stop seeing certain categories of patients. I mean, some of them have stopped seeing certain Medicaid patients in certain states. There's still a lot. I mean, 60, 70% or more are being seen and treated. But some doctors have made the business choice not to see those patients if they're getting less in what they're being paid. So there is some market dynamic going on, but it's a very difficult market as to how do you deal with that. And the reality of it is that if you take it all away,
right,
the costs of certain services are going up because laboratory testing, especially for genetic testing, is rising. It's more expensive than just doing a test on electrolytes or something that's been around forever. Certain services are being done that are costing less. So instead of doing open heart surgery for people that have cardiac problems, there's issues where they're doing now stents and things, which is still expensive, but it's less expensive than doing an open heart surgery.
Less intrusive. Yeah.
And less intrusive, things like that. There are issues with regard to drugs that are increasing, as we've talked about in prior ones, in specialty drugs that are just incredibly complicated. Newer drug has just been approved for spinal multiple sclerosis and things, and another one with regard to problems with organs that fail when after you have a particular procedure. These are new drugs that are costing something of the range of $70,000 or $80,000 a dose. Well, those are driving some of this cost up
Right.
because some of them are given in facilities rather than at home or rather than a doctor's office. Even at home, they cost a lot, but even in these facilities, they cost a lot. So in general, the cost of doing many of these services is rising, and the only real services are put it into the marketplace, try and deal with review of patients, deal with them in the doctor's office if they can so they don't come into the hospital, and of course prevention, which we've talked about a lot.
Right, right. Well, let's jump into a new topic with what's been really popular the last couple months. The ACA. Now, when the ACA was passed, there was a lot of press about the insurance tax penalties, and they were a lot cheaper than actually buying the insurance. So we just want to know in a general scope, like why did this happen? Why did they make the tax penalty less than the actual insurance?
Yeah, this has obviously created a lot of concern. There's a lot of politics going back and forth, but in reality, what the problem was this. If you're going to deal with healthcare and you have a subset of people that are sick, and in a general population, a general working population, commercial population, about a third of the people utilize healthcare and two-thirds don't.
Right.
Well, the idea was everybody puts money in and then a few people take money out. Well, that meant that if you only insured the people that were sick, then costs would have to go up because treating these people is more expensive year over year over year than just what it was 5 years ago.
Right.
So if everybody's putting money in, then people who are healthy or need minimal amount of care, they're putting money in even though they're not taking a lot out. That's general health care. And it's a difference now between whether it's the Affordable Care Act or one of the other Republican bills or otherwise, that healthcare has now been addressed and it's now American healthcare, and how do you deal with that?
Right.
Well, in that regard, one of the ways of getting people to respond was to say, here we are, buy insurance. There's 3 different levels of it to buy insurance. But if you don't, you're going to be penalized and you're going to have a tax levy on your yearly taxes for which you're going to have to pay. Well, in many cases, people didn't have the money. They couldn't afford the health insurance, and so as a result of that, they took the penalty.
Right.
Well, what you really want to do is to get them all involved, right? And there are many issues to it. There are many ways to handle it. I'm not going to deal with all of them, but I'll deal with a few of them. One is that the penalty was potentially set too low. So if you really want to get people in so that they're in fact buying insurance, they should have raised the penalty. Well, that helps with getting people in, but it doesn't help with people who can't afford it in the first place.
Right.
So now you're caught with how do you deal with the insurance and dealing with these people who have to buy it. It is common in insurance today. It's been in common insurance for a very long time of what's known as reinsurance, which means that any particular insurance company has a premium, but when things get very expensive, then they lay off some of that risk to somebody else. The reinsurance is expensive, but it deals with people who are sick. So if you're sick, there's a threshold of how much money that can be spent by the insurance company. And if it costs more than that, then it's covered by a reinsurance. So that's one way to deal with it.
Okay.
A second way to deal with this is to take a look at the different options that we have in healthcare, because what our real problem is not dealing with insurance for people that are sick, but what do you do for people that are relatively well, or they have some particular disease now known as pre-existing condition, but it's really chronic disease,
Right.
whether it's diabetes or hypertension or hyperlipidemia or whatever. And the question then is how to deal with that. And on the bottom end, there are not as many options as there should be in order to get these people involved in healthcare,
Mm-hmm.
but based on the kind of use that they would make of it. For example, young people in general. The highest cost for young people between the ages of about 20 and 45 is childbirth.
Mm-hmm.
So if you're going to insure it, then you have to focus on the areas where people are going to spend the money. Besides that, there are some self-limited kind of problems, infections for which you need an antibiotic for 10 days, issues with regard to where someone, say, breaks a leg and needs a cast for several weeks,
Yeah.
or issues that are self-limited, meaning you have the problem, you treat it, it's done,
More
and you
acute.
move on. And it's more acute,
Yeah.
right? So the healthcare needs to focus on different designs than what we have today. One of the designs that's been brought up is the healthcare savings accounts and some of those, or fiscal savings accounts.
Yeah.
And the idea is that money is being put in particular case where it's done by employers, where money is put in and then the individual can put some money in. There is a limit to it, but they can use that money, they can go out and they can price compare as to how they're going to use that money. And then money that's left over can roll over into the next year so that that pot will be available. What many people have done, though, in Congress is to talk about using that and then removing all of the other penalties if people don't participate. But what it really is to take a look at another option in order to allow people who are at the lower income scale for them to say, okay, I have an option, I can use it, and now I can go about getting involved in paying for it, not paying the penalty, but now whatever it's going to cost, I have some greater gradients of what it costs, but also gradient as to how I'm going to use this care.
Right. The only problem with the HSA would be the lower income would have a smaller bucket.
Right.
And they're often the most sick. Right.
Oftentimes. That's why the issues, as I've mentioned here, are either increasing the tax, which many people don't want,
Right.
or dealing with it as an insurance product from a reinsurance standpoint and trying to deal with premium costs.
Kind of like having a bucket and then emptying it off into another bucket.
Exactly, or part of it off into another bucket. And then the third thing is to really take a close look at the different models that we have for delivering care, and look at those insurance and try and come up with insurance that makes sense for the lower income individual and how they're going to use it.
Right.
So that they can pick and choose what they want, but they're still involved in the overall healthcare system. It is complicated, it's not easy. It must be bipartisan because all we're going to see is a Democratic bill that works under Affordable Care Act,
and
then
then
a
the
Republican
next 4
bill,
years,
another 4 years they'll go back to another one,
yeah.
etc. And it leads us nowhere in this regard. So I've only given 3. There's many, many other options to deal with this, but I've given at least some options about how you would address this.
Right. Well, that's all we have for you today. Just to wrap it up, some of the things we covered: healthcare is expensive. There are ways to dip into the healthcare costs and try to minimize the cost or minimize how it's going to affect the patient. One of the ways was through transparency. There's going to be a new Pharmacy Benefit News article written by Dr. Craig Stern. We're going to post a link. Below the video, and also there are many ways to look at healthcare insurance. We labeled off a couple of them. There are plenty to look for. It's not just a Republican. It's not a Democrat issue. It should be a bipartisan issue. Make sure to visit the Pro Pharma Consultants webpage, propharmaconsultants.com. We have an RxInfoX page that has free information. It's all available to you. We'll have new videos up every Wednesday at noon. And please like, share, and subscribe, and leave your comments below. Have a great day.